A person complains about a toothache at a certain age. Now, what age would that be?
16.
16? Wow, look at this. If you're going to take this out, you're going to be put to sleep. The dentist does not want to take this out while you're awake. You don't want to be taking this out while you're awake. All right, so you know what? Check this out. What we get in our dental office is patients complaining about wisdom teeth. Now, how do we decide how we're going to tackle wisdom teeth extraction? Now, here, take a look at this. So now, if we have, and this is very typical of wisdom teeth that we get in dental offices. What we have is, we've got a patient here. One has been removed. Now, the question that I usually get is, how come they only removed one tooth? That usually happens because at some point, the patient was complaining about a toothache. And they were complaining about a toothache upper left, right here. And so they were complaining about a toothache. Now, check this out. A person complains about a toothache at a certain age. Now, what age would that be?
16.
16? Wow, look at this. The peanut gallery. 16 years old. 16 years old, that's because of teeth comes out on a kid about 16. And they start coming out between 16, 18, 25, or never. So this tooth on the upper probably was starting to come out and it's starting to bother the patient. And then they decided to go ahead and pull that tooth out. But you've got other wisdom teeth that are available. So yes, you could pull them out all at the same time, or you could pull them out one at a time, or just pull out the teeth that bothers you. Now, when they're an adult, the problem taking them out as an adult is what we see as a dentist that is difficult to remove, or there is risk in removing them. Now, what are we looking at in risk? What are we looking at in risk?
Nerve damage.
Yeah, there's a nerve that comes down right here in the jaw, right here. And then there is a tooth that's impacted right here, and there is a nerve that comes right next to that root right here. So now, even the oral surgeon is going to be scared to take that out. So when you are sent to the oral surgeon by a general dentist, they're going to take an image right here, and then maybe all of this, and figure out, is it worth taking that tooth out? And if it's worth taking that tooth out, they'll take it out. But if there is a danger of getting very close to this nerve, they might just go ahead and leave it there. Now, if you look at the top tooth right here, it's impacted. It's never going to come out. This tooth is not going to come out. This tooth is not going to come out. That one is not going to come out. It is buried underneath this jawbone right here. So you've got a tooth that was taken out, only one, because it was probably the easiest to take out. If you're going to take this out, you're going to be put to sleep. The dentist does not want to take this out while you're awake. You don't want to be taking this out while you're awake, because they're going to have to cut some bone here. The nerve is very close to the root. They're going to have to cut some bone here. Doable, but the question for the patient is, are you going to take that risk in touching that nerve here? And so what is the downside of something happening to that nerve? What would be the downside? Paresthesia? Like, you know, that's a nice word that most people probably won't understand. You could Google that. Paresthesia. Paresthesia means that your lip starts to get numb and you won't be able to feel this. Is that worth taking that out? I think most people will say, no, just leave it in. And the oral surgeons probably say, yeah, good idea, because I don't want to take it out. But then if there's a problem here and you need to take that out, you'll take that risk because there's something going on here that you need to take that out. Talk to your oral surgeon, talk to your dentist, and see, why do we need to take this out? That one's doable, no issues there except for it's hard to get to. This one's doable. So now if you have to take all this out, you've already got one tooth taken out. If this bothers you, you take that out. But if you're going to take that out, they're going to put you to sleep. Now, might as well take this out and consider taking this out. And if they say it's not a good idea to take it out, probably a good advice. Because you've got a danger of this nerve being involved while this tooth is taken out. Make sure you talk to your dentist and watch our next video right here. Be sure to subscribe also.